Did you know silicone breast implant may trigger chronic fatigue and pain, autoimmune diseases like lupus, and even cancer in susceptible individuals? Silicone has been used for breast implants since the 60s due to its biocompatibility, durability, and texture. However, in some individuals, especially those with pre-existing risk factors like eczema or medication allergies, silicone implants may not be so compatible with our own body and can cause significant harm in the long run. In one study, 70% of patients reported a significant decrease in symptoms after removal of breast implant. This syndrome caused by breast implant is known as ASIA, Autoimmune Syndrome Initiated by Adjuvants, or BII, Breast Implant Illness. We need to be aware of this unfamiliar diagnosis, especially if you have chronic autoimmune diseases that are difficult to control. Hi everyone, my name is Dr. I'm a rheumatologist who practices integrative medicine in Hawaii. Today we are diving into an important but controversial topic, the potential long-term effect of silicone breast implants. Silicone has been used for breast augmentation since 1964. Although the implants have evolved over the past half-century, silicone is still the main component of breast implant that produces the harmful stimulus to our immune system. Silicone breast implants consist of an outer shell filled with a gel or liquid solution inside. Their surface may vary, including the presence of polyurethane coating. Since the introduction of silicone implants, the immunologic systemic side effects have been a concern. Essentially, we're putting in a foreign object into our own body. Silicone is a trace element that naturally exists in our body with about 1 to 2 grams per person. It is involved in the formation of collagen, contributing to bone health and the integrity of skin, hair, nails. However, studies suggest that silicone in the form of breast implants can cause long-term harm in some people. Silicone exists in short chain in nature, while silicone in breast implant exists in more artificial, longer chain polymer form to provide the desired structure and durability. So there are noticeable structural differences between the silicone naturally found in our body and the silicone used in breast implants. Additionally, breast implant introduces a large amount of silicone into our body. For example, a medium-sized breast implant weighs about 14 ounces, that's 400 grams, and a large implant weighs about 21 ounces, which is 600 grams per implant. This is about 200 times more silicone than what we naturally have in our body. The silicone implant may not directly trigger an autoimmune attack, but can keep the immune system in an overstimulated, aggravated state. Our immune system knows that there's something wrong going on, and they are under constant stress. For instance, in patients with breast implants, their immunoglobulin levels, IgG and IgM, were higher than those without implants, and they also had elevated levels of anti-silicone antibodies. So they start making antibodies against silicone. As I mentioned, the body naturally has small amount of silicone in connective tissues. By having too much of artificial silicone, this anti-silicone antibody development can trigger an autoimmune response against our own body. So, in essence, too much of the normalish looking ingredient in the wrong place can stress the immune system. Macrophage is a form of our immune system that acts as body's cleaning crew. It goes around the body and collects trash. In one study, macrophages were found to be filled with polyurethane from the implant in patients with silicone breast implants. This suggests that other ingredients, not just silicone, from breast implant can also put a significant strain on the immune system. The situation worsens if the breast implant ruptures or leaks, spreading the material into the surrounding tissue and potentially the rest of the body. MRI studies have shown that even without symptoms, many people experience silent leakage of their implants. You might be wondering, has this been studied? Yes, but this topic still remains a controversial topic. In a 1996 self-report study, involving 395,000 females, a small but statistically significant increase in the risk of autoimmune disease was observed in those with breast implant compared to those without. However, a more recent meta-analysis from 2000 found no direct association between implant and autoimmune disease. Over time, this topic attracted enough attraction to give birth to the term ASIA, Autoimmune Inflammatory Syndrome Induced by Adjuvant. Another name for the same syndrome is BII, Breast Implant Illness. By definition, ASIA is a syndrome that includes autoimmune or inflammatory conditions triggered by exposure to adjuvant, a substance that enhances the immune response, like silicone. If someone develops an adverse reaction to silicone breast implants, what are the characteristics? A Dutch study from 2011 screened patients and followed 80 of them who met the ASIA diagnosis after excluding other more likely diagnoses. The most affected age group was between 40 and 50, and 89% of them had breast implants for cosmetic purposes. Local symptoms around the breast included pain, capsular contraction, and lymph node enlargement in the armpit, neck, and chest wall area. Systemic symptoms reported included fatigue, pins and needle sensation in the arms, joint pain in hands and feet, muscle pain, and morning stiffness. Other common symptoms included night sweats, shortness of breath, cognitive issues such as difficulty with concentration, rash, digestive disorders, and alopecia. 11 out of 80 patients had confirmed autoimmune diseases, including lupus, Sjogren's, scleroderma, psoriatic arthritis, and ulcerative colitis. Symptoms developed on average 7 years after implantation. Most patients did not have significant past medical history before breast augmentation. However, 75% reported pre-existing allergies such as eczema, medication allergy, or latex allergy. Out of 80 patients, 52 of them elected for explantation, removal of breast implant. 70% of patients who underwent explantation reported a significant reduction in symptoms, which is a very significant finding, 70%. In my own clinical practice, I have encountered 2 patients who fit the ASIA diagnosis, highlighting how real and impactful these issues can be. Both patients carried rheumatoid arthritis diagnosis and were on multiple immunosuppressive medications, yet still had active diseases. One patient had lymph node enlargement in the armpit, and other patient had significant skin rash called hidradenitis suppurativa under the breast and armpit, and chronic GI issues with C. diff infections. The second patient had explantation and was able to get off her biologic and use less prednisone. The breast surgeon who performed the explantation made a video of the removed silicone implant and shared with my patient. The patient implant was actually found to be leaking. A chronically dysregulated, overactive immune system, as in active rheumatoid arthritis, raises the risk of lymphoma, a cancer of the immune system. The authors warns that chronic immune system stimulation induced by silicone implants is linked with similar higher risk of lymphoma. If you suffer from chronic autoimmune diseases like rheumatoid arthritis or lupus that remain active despite of strong immunosuppressions and have the symptoms mentioned, discuss this with your doctor. The terms ASIA and BII are relatively new. I'll list helpful publications in the description section for anyone who's interested in further reading. Please share this video with anyone who might find it helpful. Thank you.